Okay, good afternoon, everyone. This is Carlos with Ability PAC, and this afternoon I am very pleased to be joined by Michele Trivedi from the ARC. This is a new series that we hope to continue as we continue to share a lot of resources for the disability community. Michele is very well respected in the disability community, and I'm going to start by asking Michele to share some information about herself. So, Michele, welcome.
Thank you. Thank you for that kind introduction. I appreciate it. Well, my name is Michele Trivedi, and I work part-time for the ARC of Indiana, which is a non-for-profit disability advocacy organization. It's nationwide, and the ARC of Indiana is the state chapter, and it's one of the largest ARC chapters in the country. And what I do for the ARC is I am the manager of the ARC of Indiana's Insurance Advocacy Resource Center, or INARC. And basically what the INARC does is assist families one-on-one at no cost to investigate their insurance options, also to investigate how their insurance options may interact with Medicaid if they are also on Medicaid. And the ARC of Indiana represents people with intellectual and developmental disabilities, including autism, but not limited to autism. So any intellectual or developmental disability. And the ARC advocacy work also goes across the lifespan. So we work on behalf of children and on behalf of adults with developmental disabilities. My particular focus is on health insurance, whether that's through Medicaid or privately, or through the marketplace, the Affordable Care Act marketplace. And so I spend most of my time working either directly with families who are engaged in an appeal or in some kind of insurance problem that they're trying to work through. And then also working with our state regulators, with advocates, insurance advocates across the country to help shape insurance policy and to educate people about insurance policy, educate legislators, educate regulators about what's happening boots on the ground. So that's basically in a nutshell what I do with the ARC.
Excellent. Well, we really appreciate all your efforts. And
Sure.
so today I wanted to spend some time to help families as it relates to the insurance and navigating through that. Sometimes that can be challenging, stressful for the families. And so today I hope to alleviate some of those challenges. So one of the first question I wanted to ask you, Michele, is what is the difference between a company having a self-insured plan versus a fully insured plan, and how does that impact their employees and families?
Sure, sure. That's a really important thing for families to know about their insurance plan, because it determines what regulations and what laws govern that plan. A fully funded plan is an employer-based plan or an individual plan that an individual purchased for their family that is purchased directly from an insurance company or an insurance carrier. And that particular plan is regulated by both state and federal law. So if you are in a fully insured plan, for example, state mandates do apply to that plan. So for example, I help a lot of families who have children with autism and their insurance coverage. Indiana has the very first state mandate for autism. My daughter was the test case to implement that mandate. She was the first child covered under that mandate. And so if you are in a fully funded plan, that mandate does apply because your plan is regulated by state law and by our state Department of Insurance. So if you have an issue, you can go to the state Department of Insurance for assistance, for example, if you're in a fully funded plan. The self-insured plans are regulated by federal law. So they have to follow some state regulations, but the bulk of the regulations and laws that they have to follow are federal. And they do not necessarily have to follow a state mandate unless there is also a companion or a corresponding federal mandate. So if you're with a self-insured company, for your insurance, a self-insured employer, and it's the employer that is self-insured, not the insurance carrier. The employer is the self-insured company or entity. So if you work for an employer that is self-funded, meaning that they're self-insured, they kind of act as their own insurance company. They take that financial risk for their employees' health plan expenses. That's regulated by federal law, a federal law called ERISA, ERISA. And so it doesn't necessarily have to follow state mandates. They can elect to, they can do it voluntarily, but they have a lot more leeway in designing their employees' health plan. And so it falls under different regulations, and they have a lot more leeway than the fully funded plans that fall under state regulation. It's certainly a little bit more complicated than that, but in a nutshell, that's kind of the basics of what parents need to know.
Okay, wonderful, wonderful. Well, thank you for that great explanation. I know
Sure.
sometimes it's difficult for families to understand that they work in Indiana, but their company insurance is based out of Rhode Island, for example,
Yeah.
and you know how that relates to the family. So I think that's important to understand that. Just
Yes, absolutely. You can work in Indiana, but have your insurance contract actually be in a different state and be regulated by a different state's laws. So it's something that when you're looking at your benefits, you kind of have to do a little bit of digging and get some assistance from your human resources department to figure out, am I fully funded or self-funded? And then if I am fully funded, what state does that fall under?
Wonderful. And then here in Indiana, we have that your family helped the Indiana Autism Mandate. Can you
Yes.
explain to our audience what is the Indiana Autism Mandate?
Sure. The Indiana Autism Mandate was the first comprehensive health insurance reform law passed in the United States. It was passed in 2000 and went into effect in 2001. And it was basically passed more of as an anti-discrimination piece of legislation because the history of it, in a nutshell, families in Indiana were finding that when their child was diagnosed with autism, they were being dropped from their insurance policy, and the insurance carriers were saying that they were uninsurable. And then the child was left with either no insurance, or they had to go on the state high risk plan. And not all states have those, but luckily at the time in Indiana, we did have one. Or they had to go on Medicaid. And parents, in a time when you are getting a diagnosis, and that is a very, can be very upsetting and very trying time. And then you get this letter from your insurance company that your child has been dropped. So that was a big concern among the autism community. If the child was lucky enough to not get dropped by their insurance company and they were able to keep their insurance, the insurance carrier still would not cover anything that related to autism. And a lot of times they would not cover anything that could remotely be related to autism. For example, with my own child, after she was diagnosed with autism, her doctors determined that because of her severe language regression, they really should test her for a brain tumor. Our insurance company, because she had a diagnosis of autism, would not pay for the MRI and for the battery of tests that was required to determine whether or not she had a brain tumor, solely because she had a diagnosis of autism. They were looking for a tumor. They weren't looking for autism, but because she had autism, they would not cover something related to her brain, to neurology, to seizures, that kind of thing. And so that kind of conduct on behalf of the insurance carriers really led the legislators who were working on the autism mandate to say, well, wait a minute, this law should go beyond just legislating that children can't be dropped solely because of having a diagnosis of autism. There are evidence-based treatments out there for autism, such as applied behavior analysis therapy, speech therapy, medications, occupational therapy. Why aren't insurance carriers covering that if those treatments are out there? And why
Right.
aren't they covering that if autism is, in many ways, a chronic neurological condition? So the mandate went from parents asking, can we legislate that they please can't drop our children completely from insurance, to becoming more of an anti-discrimination piece of legislation to say to the insurance carriers, hey, you really need to treat autism like the chronic condition that it is and cover it in a manner that is not less favorable than how you cover other chronic physical conditions. So that's how the autism mandate came to be. However, after it was passed, we had a lot of difficulty getting it implemented. And so my daughter being the test case, the first child who attempted to get coverage, I spent 3 years doing appeals, administrative court hearings, working with the Department of Insurance to get the first claim paid. And once that happened, then the Department of Insurance got a group together, including myself, to write Bulletin 136 to give the insurers some instructions about how the autism mandate should be implemented. So that's the history of that in a nutshell.
Wow, that's
lots
truly,
of years of work in about 2 minutes.
Wow, well, I know. I imagine to go through that, and because of your direct efforts, so many other families have been able to take advantage of that. And I just want to thank you for that, for your efforts with that, because I guarantee you that was probably, I know you just covered it in 2 minutes, but that was probably several months, if not years, of hard work, of advocating on your part, and for your family. So thank you.
Oh, sure. It was my full-time job for a few years, for sure. But I have to say that getting that mandate law passed was a really amazing team effort on the part of many parents, several parents from Eli Lilly, several parents from the education world, several parents who were physicians, and then also the ARC of Indiana in conjunction with the Autism Society of Indiana and the Indiana Resource Center for Autism. We all got together and really worked well as a team to get that law passed. And so have to give credit where credit's due and really express my gratitude to those parents who got that started before I even moved to Indiana. So I was lucky to come in at sort of the tail end of the passing of the law, and then was lucky enough to be in the position to be able to fight for my daughter because of my background in managed care contracting and health administration to make that happen. So it was a good team effort.
Absolutely. So again, thank you for taking the time to explain all that. And then I think it's important for families to understand how they can get help, because as you begin to navigate through the insurance from the first diagnosis to whatever other needs, there's resources and things that are available to families. And I wanted to ask, what is the role of an insurance advocate, and how can the advocate help the family?
Sure. The role of an insurance advocate is really to help in many ways to be a translator. Your insurance policy, you get this booklet when you're picking your insurance, and it has kind of a summary of what your policy is. But a lot of insurance contracts are with your employer, or even your individual contracts, are 450 pages long. And they're written in language that isn't readily accessible to people who don't work in the insurance industry or in the medical field. And so what insurance advocate can do is help you take a look at your policy and understand what things are covered and what needs to be done to get them covered. Things like, what's a pre-authorization, what's a medical review, what's a grievance and appeals. And so to understand those terms and kind of translate them into everyday language so that people can understand, first of all, what am I entitled to? Because when you buy insurance, you're buying a product, you're buying a service. And if you're not getting out of that product what you are paying for, you want to know that. You want to know what you're getting in terms of purchasing your health insurance and what's supposed to come along with that product. And then the other thing that an insurance advocate can do is help when there are hiccups, there are bumps, there are appeals, you get denied for certain services. And if you want to appeal those, a health insurance advocate can help you understand that process. That process can vary from company to company. It can vary based on if you're in a fully funded plan, it's different than if you're in a self-insured plan potentially. If you're with a federal employee health plan, it may be different. If you're with TRICARE, it may be different. If you're with a union and have a health plan that's based on collective bargaining, it's going to be a little bit different. So a health insurance advocate can help kind of tease some of those things out and help you understand the process. And then a lot of what a health insurance advocate can do is review an appeal letter and give suggestions, review the health insurance policies, clinical guidelines, and help give some guidance as to, okay, the denial was about this, and here are some things that you need to address in your letter, and here are some things you need to document in your appeal packet with your supporting information to make your case better, to demonstrate that medical necessity to the reviewer who's taking a look at the case. So it's a lot of information, some coaching, and really guiding parents and providers through the process.
Great. So a family goes through, they do all the hard work, they get an appointment scheduled, they fill out all the insurance paperwork at the doctor's office at 3 or 4 pages long, and sometimes 5 and 6.
Yeah.
They go through, they get the care, the treatment needed for their loved one, and then lo and behold, and I think you started to allude to this, so then in the mail they receive a denial of coverage. So what should families do whenever they get denied treatment or care for their family member?
Sure. As a lot of things in life, with health insurance, preparation is really key. What I try to really coach parents to do is to take a really good look at their health insurance options when they're selecting their plans during open enrollment. And on the ARC of Indiana website, I have a really nice grid that I adapted from a grid that's available on healthcare.gov. And I adapted it for families who have loved ones with special needs, so that you can look at your insurance options and kind of check the boxes of, does it have the network I need? Does it cover the services that my loved one is likely to need? So preparation is really important. Picking the health plan that really fits the needs of your family. And sometimes that's not the least expensive health plan in terms of premiums or copays or coinsurance. But when looking at all of the different elements that go into the health plan, it may actually be a better deal for your family at the end of the day, because you're paying less out of pocket, or because you're getting more coverage than you would with maybe another plan. So it's not always about which one has the lowest premium. Sometimes those aren't the best plans. And hopefully you have some choices and can decide among those. So preparation is really key, and picking the right plan, making sure you have the right network. But after all of that preparation, there are still sometimes going to be denials. And so when that occurs, the most important thing to do is to communicate with the provider. What does that denial letter say? What are they saying is the issue? Do they just need more information? Or are they saying that these services are just not medically necessary? And then if it's an issue of medical necessity, then it's working with your provider to find out, okay, what are they saying isn't medically necessary? Is it that the services are too many hours, too many visits, too high of a dose, too intense, should be in a lesser intense environment? What's the reason for that denial? And then write a letter of appeal that argues basically against those reasons that were given. And so a health insurance advocate can come in at that point and help with the strategy of writing that letter and really analyzing the denial letter to figure out, why are they really denying this? If it's a procedural issue, did you miss a deadline for filing a pre-authorization? Or are you asking for coverage for a service that just is excluded from your plan? That's one thing, and some of those things can be corrected and more information can be given. Sometimes if you violate the policy and the coverage hinges on that, there's not a whole lot that can be done. But when we're talking about medical necessity, that's where you really have to work with your provider to get that documentation, because the medical reviewer isn't going to come out and meet your loved one. They can only make a decision based on the quality of the information they're given. And sometimes it requires giving them more information. And then sometimes there's an issue of, are they following? Is the medical reviewer following the policy? Is the medical reviewer following standards of care? is the medical reviewer following, for example, the mandate law or federal mental health parity law? And so that may come into play in an appeal as well, because, you know, we're all human, and sometimes we make mistakes, and sometimes medical reviewers make mistakes, sometimes providers make mistakes. And so it's going through and finding out what's missing here that is a barrier to coverage.
Excellent, very good. Thank you for that. And in the
Sure.
event that they exhaust all appeals and everything,
Mhm.
is there a final step that they should do?
Well, the nice thing about insurance, it's a little complicated. It depends what the process you go through depends a little bit on what your insurance plan is, whether it's fully funded, self-funded, collective bargaining based. But in general, you typically have some kind of internal appeal that you go through with the insurance carrier. And then most plans, because of the Affordable Care Act, most plans are going to have some kind of option, not all, but most, will have some kind of option to go to what's called an external review, or what may be called an independent review. And that is where an organization that is not affiliated with the insurance carrier involved will do an objective analysis of the appeal and of the denial to see if it is in accordance with the policy and in accordance with standards of care and in accordance with applicable state and federal law. So, so that is a nice option for a lot of families, in that if things don't go your way in the first or second level appeal, internal appeal, usually there is an option to have some kind of external or independent review of a medical necessity denial.
Excellent, very good. Thank you for that, because like I said, you know, there's times when families receive those and there's the frustration of, you know, how to handle those. So I think that's
Yes,
very valuable information for families. You
yes.
know, as we know, a lesson, I think it's been a little over a year as far as the affordable health care that was passed,
Mhm.
and wanted to ask, you know, which or do all plans in the ACA cover ABA therapy?
Yes, all of the plans on the Affordable Care Act that are in Indiana, that are sold in Indiana, must cover autism treatment and must cover ABA therapy for autism treatment. And the basic, in a nutshell, reason for that is that our mandate was passed well before the Affordable Care Act was passed. And so it was included in the essential health benefits for the state of Indiana, based on the model policy that was used to determine what our essential health benefits would be. So we're very fortunate in Indiana to have such a well-established state mandate, because it did result in our Affordable Care Act marketplace plans sold in Indiana to have to cover that because of that state mandate. If you live in another state, that may not be the case. So if you live outside of Indiana, you would need to check with either on the Autism Speaks website or with your state regulator who would be involved in the marketplace plan to determine if that's a possibility in your state.
Okay, wonderful. Because I know from time to time in different, you know, social media blogs and so forth, you see people asking about different plans and what they
Mhm.
don't cover. So it's important for them to understand that regarding the autism mandate, that it does
Yes.
apply to the state plans that are offered.
Yes.
So very good. Now, and then also in Indiana, and I believe nationally as well, that there's recently been some Medicaid the plans to also provide coverage for ABA therapy.
Mhm.
Now, what are the requirements for, so if their family members go to one of the ABA centers, what are the requirements in order to bill for Medicaid, for
Sure.
ABA therapy?
Yes, Medicaid uh, is supposed to cover autism treatment under a program, part of the Medicaid program for children, that's called EPSDT, and that stands for Early Periodic Screening, Diagnosis, and Treatment. It applies to children who are 21 years of age or younger. And In a nutshell, what EPSDT is supposed to cover are services that are medically necessary to prevent or reduce a disabling condition or potentially disabling condition in a child. And so it's through that program in the Medicaid health plan, not in the waiver plan, but in the Medicaid health is part of the health plan, part of the coverage for that, and is one with autism are under age 21. So for an ABA provider to be able to bill for ABA under Medicaid in Indiana right now, they have to be an Indiana Medicaid health plan provider, which is different than being a waiver provider. So they would have to make sure that they have applied to be an Indiana Medicaid health plan provider. And they, at this point, have to have an HSPP or a health services provider in psychology who is either on staff or contracted with the ABA provider to oversee the plans. Because right now, our state Medicaid system does not have a provider type for ABA therapy at this point. It's something that they're working on, and we were told last week in a meeting with Medicaid that should be ready to go sometime in 2017. And then ABA providers would be able to bill independently. BCBAs and BCBADs would be able to bill independently, but right now they have to bill with an HSPP. So that's one big requirement. The other requirements that the ABA provider would have to have is they would have to abide by all of the qualifications of being a health plan provider. And they would also have to abide by all of the billing, pre-authorization, treatment plan submission, policies and procedures of Medicaid as well. So those are some of the requirements of an ABA provider. When an ABA provider applies to become a Medicaid provider, they become a Medicaid provider in traditional Medicaid, which is the disability Medicaid, that health plan that comes with being on a waiver. And then if they also want to provide services to children who are on Medicaid who are not on traditional Medicaid, then the ABA provider also has to get credentialed and join the network of each of the managed care organizations that are administering our Medicaid plan. So they would become a provider on traditional Medicaid, and then they could take traditional Medicaid patients. And then after that, they would also have to get credentialed with, for example, Anthem, MedWise, and MHS, and any of the other managed care companies that are administering our Medicaid plans. So if your child has Medicaid, you would want to make sure to check if your ABA provider is in the network that your child is in. Because even though they're a traditional Medicaid provider, if they're not in, say, the Anthem network, if your child has Medicaid through Anthem, they would not be considered a network provider. So does that make sense?
Yes.
It's a little complicated. They have to be on multiple networks if they want to, open up treatment to children in those networks.
Okay, great. Now, which centers are currently accepting Medicaid for ABA?
I don't have a list with me of which centers are accepting Medicaid across the state. That would be difficult to chase down. Several are in the process of applying, and that can take time. We have discussed with Medicaid that we have concerns about their network and about the network issues, especially with a particular managed care organization that seems to have a very narrow network. So right now, my advice to families right now is to communicate with your current ABA provider or an ABA provider that you would like to use and ask them where they are in that process of applying to be a Medicaid provider, and then also to be on the networks of the various managed care organizations. Because it is a process, it takes some time. A lot of ABA providers did not have HSPPs on staff because is not a requirement for private insurance.
Mm-hmm.
And so they had to go out and find one who was willing to contract with them, and that has put some barriers in place as well. But in general, right now, the networks are pretty small. And there are not, if you have 5 ABA centers in your city, there may be only 1 or 2 who have gotten through the Medicaid process. There are some ABA centers who have decided not to engage at all in Medicaid, in providing services through Medicaid, because of various reasons, reimbursement reasons, also reasons of administrative hassle, because you have to apply to be a traditional Medicaid provider, and then you have to apply with all the different managed care entities and get credentialed with each and every one of them. And some have decided that is a lot of paperwork that is just not worth it to them at this point in time. There has to be, there are network standards that have to be in place for Medicaid. There has to be accessibility. EPSDT, because it is medically necessary treatment, there cannot be waiting lists. So that's not to say a provider can't have a waiting list, but Medicaid can't have a waiting list for medically necessary services. So if you cannot access a provider anywhere around you, you definitely want to communicate with either your case manager, with your managed care company, with the folks at Medicaid, so that they are aware that access is a problem in your area.
Okay, very good. And as a parent, you go into a center, you're taking your child, you're getting the care that you need, everything's going great. What advice do you give to parents as far as the checks and balances of the providers and the insurance? What can parents just do to ensure they're being billed properly? And all those things are important, because they don't want to get capped out and then find out that there's missed. So what are some best practices regarding that?
Sure. Best practices, you definitely want to pay attention to your explanations of benefits. Every insurer, Medicaid, private, you will send you directly a piece of paper is called an explanation of benefits. Many companies have them available for you to look at online for your child or for yourself. And that explanation of benefits, or EOB, outlines exactly what services were billed to the insurance company or to Medicaid, and what services were paid for, and if some services weren't paid for, why they weren't paid for. And so you'll want to keep an eye on those, because if you happen to know that we were on vacation the last month of September, but your ABA provider billed ABA therapy for the last week in September, and your child wasn't there, you can't bill for a service that wasn't provided. So there's something amiss there.
Exactly, right.
So you'll want to take a look at that. The other thing is communication, because there does need to be, ABA is a high level of parental involvement, not only in learning about ABA and participating in your child's therapy and learning the tools to take care of at home, but also from a logistical standpoint, it's good to be involved and understand what's going on in terms of what's happening with your insurance, because it can really affect your child's access. For example, if you change insurance and you don't tell your ABA provider, and they find out 3 months later that ABA is not a covered benefit in your new policy, and you didn't investigate that, or you were misled into thinking that it was covered. I've worked with families where they were told by 3 or 4 representatives from the insurance company, oh yeah, this is covered, and they were mistaken. It wasn't. So you want to make sure that you are communicating with your provider about those things, because if you change insurance plans and either you were given misinformation, or you didn't check to see if ABA is a covered benefit, and it turns out it's not, then they have 3 months of services that they've provided and that, they should be paid for. And how is that going to happen with this issue with insurance? So you want to make sure that you're on top of your policy. And when you get into open enrollment, get that grid and compare your plans and verify that services your child is going to need are indeed covered. A lot of employers see the benefit in switching from being fully insured to being self-insured. And that's typically when families get surprised that ABA isn't covered anymore. And so you have to watch that, because it's not just your great big companies that are self-funded.
Right,
Some
right.
relatively small companies can be self-funded.
Mm-hmm.
And so you'll want to watch that, so that you're not surprised 3 months later that, oh my gosh, the claims are getting rejected because this is not part of that policy. And then it becomes a headache all the way around. So it's not fun. I don't think anybody says, hey, it's Friday night and I'm going to pull out my insurance policy and read it. But it's such an important part of your life, to not take the time to understand it, especially if you have a child with special needs who's going to need to access some special services. You want to make sure you do your homework and ask for help. You have benefits people who can help you. You have insurance advocates who can help you, and weed through the legalese and figure out what's covered. But that's a really big piece of it, is communicating that with your providers as well.
Very good, very good. Well, I think that there's been a lot of great information shared, and I know that I have been asking the majority of the questions today. So I thought I would give you an opportunity to share with families as far as your advice, your words of wisdom, if you will, just some help as they, again, at the beginning we talked about navigating through the whole insurance. So I just wanted to provide you that forum to do that, because I value your input, and I think it would tremendously help our families just to hear you share some of those. So if you're okay, if you're okay to do that, I'd love to hear your thoughts on it. Some closing thoughts.
Yeah, absolutely. I think right now, given the time of year, we're getting into that season of open enrollment for a lot of people. And so I think that the first piece of advice or suggestion I would make is to do your homework about your options. Go on the ARC's website and get that grid. Do the comparison. My husband and I get a pizza, and we, sit down and try to make it as fun as possible.
Sure.
To do that for our own family.
Right.
We have to do that ourselves. Definitely do that. And for families who are with employers who are self-funded and who are under ERISA and who do not elect to follow the state mandate for autism, for example, you do have options. You can, in order to get your child covered for ABA and for autism, if they're not on Medicaid, which is supposed to be covering ABA now, you can get an Affordable Care Act plan from healthcare.gov just for your child. And
Okay.
and those child-only plans your child can keep as long as it is unsubsidized. They can keep that if they were to get on the Medicaid waiver and then subsequently have access to Medicaid as well. Some families choose to keep both. Some families, don't hang on to their Affordable Care Act plan once their child is on Medicaid, but that is an option. And there are going to be a lot of changes in the marketplace, the Affordable Care Act marketplace in Indiana this year. We have 4 insurance carriers that are not going to be offering policies on the Affordable Care Act marketplace this year. They're IU Health Plans, PHP or Physician Health Plan of Northern Indiana, Southeastern Indiana Health Organization or SIHO, and then also United Healthcare Group or UHC. And I think in some markets it was called All Savers. They are not going to be on the Affordable Care Act marketplace or the healthcare.gov marketplace next year. So the 2017 plans. I was on the phone with the Department of Insurance yesterday, and they did say that IU Health Plans will offer individual unsubsidized policies only on healthcare.gov. So that would just be an option for an individual unsubsidized plan, but otherwise they're not going to be offering marketplace products. Then the carriers who will be on the Indiana Affordable Care Act marketplace in 2017 are Anthem, CareSource, Celtic or MHS, and MedWise, MDWise, MedWise. So those are going to be the 4 options. They may not be options in every county. What products are available will vary from county to county, and the premium levels will vary from county to county.
Okay.
But those are across the state. Those are the 4 carriers that are going to be offering Affordable Care Act plans. So if you have an Affordable Care Act plan with IU Health, with PHP, with UHC, or with the Southeastern Indiana Health Organization, you likely are going to have to make a change, unless you're with IU Health and you have an unsubsidized individual plan. But other than that, you're likely going to have to make a change. So you'll want to be sure that you start early.
Right.
Unfortunately, open enrollment's going to be narrower time frame this year, because the Affordable Care Act has been up and going for a couple years. They had a really long open enrollment the first year. It was a little bit shorter
True.
than that.
Great point.
Yeah, and it's going to be even shorter this year. And so you want to do your homework. You want to start doing your investigation early on. You don't want to be on the internet the day before open enrollment closes trying to get your application in. That's going to be very stress inducing.
Absolutely.
So you'll want to make sure to get that taken care of ahead of time. And also, too, your health insurance advocates and your health insurance navigators, they're going to be deluged with phone calls those last couple days. And if you need help, you're going to be waiting in line with a lot of people those last few days. So do it early if that's something that you need, because then you will get better help. It'll be less stressful. You'll have the time to really look at your options and really weigh what your options are. So pick a weekend, in early
pizza.
Get pizza, pick a weekend early on in that open enrollment period, and then plan something to reward yourself for getting through it, is my recommendation there. And we'll be putting more up on the ARC website about the Affordable Care Act and open enrollment, as we get more information. But that's kind of the latest and greatest right now. And so that can be a nice option for families who have those ERISA plans that don't cover autism. They could look into that. And then as far as Medicaid, there's going to be a lot more changes coming on the horizon. And so, you'll want to definitely keep in touch with the ARC, with the Autism Society of Indiana, with ASK about special kids, Family Voices, covering kids and families, all the different advocacy organizations to keep touch with information on what changes are coming with Medicaid. We are experiencing some network issues, so Medicaid's definitely aware of that and looking into things. And so you'll just want to kind of stay tuned and keep up on some of that information as well. And if you're having trouble accessing autism treatment through Medicaid, please reach out and let the different, whatever advocacy organization you like to work with, let them know. Because we have at least a quarterly meeting with the gentleman who is running that program. And we're able to bring him specific information about kind of boots on the ground, what's happening, so he can go back and troubleshoot. And so he's wonderful. He's very happy to troubleshoot. And so that partnership is a big value.
Great. Excellent. And Michelle, how can people reach you?
People can reach me through the ARC of Indiana website, or they can reach me through the ARC of Indiana's Facebook page. They can also email me directly at mtrivedi@arcind.org. And they can also contact me. My direct line is on the ARC of Indiana website as well. And they can call me directly and leave a message. I will get back with them just as soon as I can. And I cover the whole state, but I try to get back to everybody within 72 hours unless I am out of state.
Great. So, well, we know how hard you work, and we appreciate it.
It's a labor of love. Being a parent of a now adult with autism, I can't believe I'm saying that, but it's definitely a labor of love. So.
Very good. Well, we really appreciate your time for being with the Ability
My
Pack.
pleasure.
Thank you. Please also, if you're listening today, and we will be reposting this as well, please subscribe to our YouTube channel. You can also find Ability Pack on Facebook as well as Twitter. Our goal is to share great resources for the disability community, share the programs, the wonderful resources, and to help our community because I think it takes a village to help our families out. So, Michelle, thank you so much for your time today.
My pleasure.